Good evening. I'm going to call the Board of Health meeting to order at 6:35 PM. If everyone could please rise for the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America
and to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. All right. Up next is the reorganization of the Board of Health. Congratulations to Ted for getting reelected to the board.
I thought I would have competition this time around.
Yeah, no,
None.
you did. Good
None.
job.
No one.
Yeah, got right out there. Okay. So we need to nominate chairman.
Let's nominate a chairman. She's sitting in the seat already, I think.
Okay, I have a nomination for chair. Do I have a second?
A second.
I have a nomination and a second. Any other discussion? Seeing none, all in favor? Aye.
That was easy. You don't even mind?
No, it's all right. I'll stay one more year.
All right. Well,
Because
we'll
I'm up
talk.
for
All right.
re-election, so.
I'll do it next year. It's fine.
Okay, number 3. We're going to go back and accept the minutes for the April 11th, 2017 meeting.
Okay.
Well, you accepted the nomination, now you have to take a vote.
Just did.
You took a vote?
Yes.
Okay.
We left him out.
I think we did. Did you
No,
want
I
to? Did you want to go?
I don't get the vote.
Did you want to add any sidebar to it?
I make a motion to accept the minutes of the April 11th, 2017 meeting.
Second
I have a motion and a second. Any more discussion on those minutes? Seeing none, all in favor? Aye. Passes unanimously. Now, number 4, accept the minutes of the May 23rd meeting.
Make a motion to accept the minutes of May 23rd meeting, 2017.
that. Second that.
I have a motion and a second. Any other discussion? Seeing none, all in favor? Aye. Number 5, Region 2 Emergency Preparedness. Nothing news going on at this time. So, we will move right on to,
Is, if I may, there was.
oh, I'm sorry. I'm just going to cut you right off.
A notification that we've got some deliverables being made available next week or the week after. I'll have to go in and pick them up in Worcester.
Thank you.
I don't know what it is.
Yeah, I saw that. Thank you. That would be good if you could.
I see we have a new filing cabinet in the office.
Yes.
In the box.
Yes, Teresa likes the box.
Is it in the box, or is you just keeping the box
It's in the box.
for eBay shipping?
Prevent it from being scratched.
Okay.
It's in the box.
You guys.
It's gonna have to come out eventually. Okay. Number 6 is the agreement for the health agent services, his yearly contract, the Purcell Associates yearly contract.
Has something changed about it?
What has changed is his pay went up slightly. Slightly.
It's creeping back up. It's gone from whatever it is, $1,416 a month to $1,500 a month. I think I got about an $84 a month pay raise.
Was that in the budget? Is that why it's just there?
Yeah, we budgeted.
Conveniently, that's what the budget allowed, so.
Oh, okay.
Yes.
So you're not asking for something more than we can allow?
I did ask and they laughed, so.
Sorry.
Did it already go through what did it go through
What we do is we submit a budget back
That's
in
funny.
March.
January, yeah, it starts in January, but March is the final time.
Right, so we submit the budget to the town administrator, Board of Selectmen, and they review it with the FAA, and then they come back to us with what's been approved,
I see.
so.
And nothing else has changed except for that compensation?
That is correct.
Is there vacation time listed in here any at all? I'd like to cut some of that.
No, he's,
Or could we add that he takes one of us with him each time?
My car, they're taking the car away from me.
Dang it.
so, we need, a vote to approve the contract, and I have the original here for signatures. If Tom agrees.
I do.
Okay. So,
So it's not a motion, it's a vote.
it's a motion to
A motion
accept
to
it, right?
accept
the,
oh, go ahead, you were doing a motion.
accept, to- what do I want to call it? The agreement for the health agent services?
That's
Okay.
fine. Okay. I have a motion.
I have to second that motion to
You-
accept.
I have a motion and a
nervous.
second. Any other discussion about it?
Mm-mm.
Seeing none, all in favor?
Aye.
Okay, so I'm gonna sign this, and we'll have Tom sign it, everybody will sign it. 6, 2, 7. I'm gonna go this way and it will come back to you. You'll be last. Okay. Thank you, Tom, you're doing a good job, great
Thank you.
job.
Thank you.
We like having you here.
I'm flattered. Thank you.
I know that means so much to you.
It does. It really does. It's nice to be appreciated.
Okay, so next up is item number 7, nursing services contract review, renewal. So, I'm gonna let you talk a little bit about it, and then we'll go from there.
Okay.
If you don't mind.
What we've done is we've extended an invitation to, it's time for review, renewal of nursing services contract with providers. What we've done is extended an invitation to the town of Sutton, and Cheryl Ruinski is here from the town of Sutton to, she's the town nurse as well in Sutton. And she's submitted a sample of a proposal to provide services for the town of Sutton. Unfortunately, with a short notice and town manager being away, this would amount to an intermunicipal agreement with Sutton. Also, we have a proposal, and we extended an invitation to Harrington Hospital and for their Harrington Preventative Health, and they submitted a proposal as well. I suppose at this time, you've had an opportunity, has the board had an opportunity to review the proposals, even if you just,
Yes. Have you had a chance to look through?
probably the biggest concern that I do have is accessibility to any records, and making sure that the records that are generated for activities and treatment and preventative health the records become property or available as property of the town of Dudley and not for our contracted individuals. Not necessarily. They can keep the copies, but I think that we're the keeper of the records for any health matters, for disease control, disease immunization, and any of the other health activities. And I suppose if you'd like, Cheryl is here to answer. Deb obviously didn't make it today. Cheryl will be available to answer any questions that you do have.
Okay.
One thing I did find that most of as far as the treatment is concerned, it's Maven is where we can get virtually all of our information from, with the exception of immunization records, and Cheryl already alluded to where, and she would make sure that the permission slips for immunization would be forwarded to the Board of Health to make sure, copies of them, to make sure that we do have records of all people that are immunized in the town as well.
Mhm.
Okay, but
Yeah,
if you have any questions for Cheryl?
You come on up and just introduce yourself to us. You can have a seat right there. We're gonna move that up so she stops smacking it. Hi, welcome this evening. Thank you so much for coming.
Thank you. Thank you for the invitation.
I'm gonna, I have a couple questions, and I'm gonna,
Sure.
Roberta's our nurse, so we're letting her handle, so with Harrington right now, we get a monthly fee that we have to pay for all services provided, and we get a listing of like how many immunizations were given, or treatment for this, or treatment for that, just a basic, nothing else, except is that something that you would provide to us?
Basically, fees, monthly fees would be, submitted monthly, if you'd like. Also with, let me just backtrack a little bit.
Sure, no problem.
I cover 15 towns already.
Okay.
For public health nursing services. In addition, I'm the public health director for the town of Sutton, so I wear many hats, inspector, things like that. My fees that I do for my towns are either monthly or quarterly based on the town's specific recommendations. If you want to be billed monthly, you get a monthly fee with a breakdown of the work that I have done, including a copy of all the investigations and diseases on Maven that I've worked on.
Excellent, thank you.
I was just thinking.
That's fine.
So, I think my concern is what Tom was talking about, the records of all, I don't wanna call them patients, cause they're not
Clients.
constituents. Huh?
Clients.
Yeah,
Clients, right.
to keep here, and would we be made aware of anything new that popped up in our town, like TB or anything like that? And it would be in that report?
If there is something that you would like to know about,
Yeah.
I'll be more than happy to keep you abreast of it. Some towns don't want to know anything. They just want the work done and that's it. If there's like an outbreak of something, I definitely let towns know. If there's something unusual that's going on, I just inform the towns. Whether you choose to follow it up or you want me to keep you in the loop, that's all up depending upon each individual board.
If I may, I think it's, the most important thing is to make sure that we're informed. We're not going to impede your, what the requirements are for you to do your job. We're not going to tell you how to do your job. It's just that we should be kept in the loop. We have more people answerable to, to the public health for the community. And we want to make sure that we stand ready and be informed on what's going on. That's all. More informed than anything else.
Yeah. I think
It's really important.
one of our biggest fears, or one of the biggest things for us as board members, is if in any situation we don't find out something and then somebody comes and says to us, I heard blah, 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 and we're going, not specific
No.
private information, but just at least if we're
You're aware of the
things.
situation.
We're
We
aware
just
of it.
want to be aware we're not
gonna
going
hide
to,
on
I would never, I will tell you, I am very open, I'm very communicative. Tom and I have worked together for many years. I work for several local towns in this area. I keep them abreast of anything that is out of the ordinary or just something they should be aware of. So that way they know if they get anything, any feedback, they're aware of it.
thank you, that's our
That's it.
biggest thing, is just being caught off guard and looking,
Oh, I
you
would
know.
never do that.
Right, like if something goes, if there's something that we're unaware of, I work as a school nurse, so for instance, we didn't know of something that a child contracted over the weekend. That Monday, the public health nurse called us to tell us that the kid had it. So those are the little things, like, we don't always know what's going on in the schools, so it's always good to know. You don't want to be caught off guard, because we certainly were caught off guard, so.
I will say this because I also wear a hat that is a school nurse also. Being in the public health realm, sometimes we don't know that kids are in school situations, things like that. So again, whether we're in a public school, private school, or homeschooled, and lots of times we don't get information on Maven as quickly as it spreads through a community, unfortunately. So that is a little of a sticky situation.
Typically, the classic that we get notifications is Friday afternoon from the state. Anytime that there's something going on, it may have happened 2 days prior, but we seem to get it Friday afternoon before the close of business. And we're trying to, at that point, muddle through what actions can be done, and it's tougher over the weekends, and not a question of because of availability, because oftentimes the client or the affected individuals are not available, or we don't have any ability to contact people because we don't have enough information.
Right.
I think our biggest thing is, number one, is to keep us informed. Number two is just to keep in mind that any public record, or any health records that are generated have to be, they're part of the town of Dudley's, we're the keeper of the records as well. So, I mean, we're the keeper of the records according to the state law, so, for any of our community constituents. And it's important that that's why we have to know everything. And we can file it, we already know, basically familiar with HIPAA laws and confidentiality and all of that. And we have actually we have a right and we have an obligation to get whatever information that we do need. That's probably the most important thing, is keeping an open channel and a conduit for communication, that's all.
That being said, that was, are you opposed to, if we ask you to come, if, let's say we haven't talked to you at a meeting, you may have talked with Teresa recently or Tom, but if we ask you to come to normally they're Tuesday nights, a meeting, is that a problem?
It wouldn't be, except if it falls on my Tuesday night meetings for
Okay.
the town of Sutton. Other than that, I would have no problem at all. I do that with all my towns that I cover anyway. I meet with them at least once, if not more than twice a year.
Okay.
Just to follow up, put a face to a name, let people know how things are going in general, and go from there.
Do you have a standard night that your meetings usually are in Sutton? Like a
Last
standard?
Tuesday.
Okay. We're usually the third Tuesday for most part, so, and we're very easygoing, I would say. Ted, do you have any questions?
I don't.
Roberta, do you have anything else?
No.
Do you have anything else that you'd like us to know?
I just want to let you know that as a public health nurse for several communities, I am on Maven constantly. Also as a health director myself, and I'm managing a health department. Being a public health professional, we are on call 24/7, so I am very familiar with emergency preparedness as well as monitoring Maven. I monitor it. I have a computer that I monitor Maven at home, even on a weekend, on my day off, on things like that. Try not to, but I, just kind of glance at it, things like that, in case anything crops up. But all the EPIs at the state lab definitely have my cell phone if they really need to reach me in an emergency, things like that. But I've dealt with a lot of sensitive and high-profile cases, so I'm very familiar with how to handle those and work within a community involving children and sudden illnesses, including death. So,
And one question I do have is if the board does make a change, are we supposed to notify Maven of the change of?
that will, yes, that would be through the board.
Okay. All right, so, and Teresa already has access through Maven, so.
It would be an email and a telephone confirmation with Lionel White at the state.
Okay.
So basically what we need to do tonight is, because our agreement with Harrington is up
July 1.
July 1.
Okay.
So we need to make a decision as to how we want to go about if we want to stay with Harrington or if we want to entertain someone new.
Is Harrington here?
No,
Did we invite Harrington here?
yes.
Are they not here for a reason?
Can I answer?
Go ahead.
They felt that there were no changes to the contract from all previous years and were unavailable and unwilling to change their schedules.
When was the last time they were here at one of our meetings? Was
The
it a year
first
ago?
meeting.
February.
One of your
Oh.
first meetings, correct?
Mm-hmm.
Was it this year?
Was it? Yes.
Was that her that brought the
brought the
students?
Student, right, so that was,
Yeah.
yeah.
Oh, okay.
Was that your first time meeting her?
Yes, yes.
Okay, so that gives you an indication.
I understand.
So Deborah's not the one in charge of the contracts, though. It would have been Arlene Smith, and she was the one that was not available to come tonight.
But
Not-
the
Was Deb invited?
She was invited.
But the nurse herself was the woman who brought
Yes.
in the students, and, right, I remember the meeting very well. Okay.
Do we need to go to, is the Board of Health the one that authorizes the contract, or is it the procurement officer that does that? Before you make a decision, I think you might want to run it past Greg to make sure. I don't know what to tell you.
I see on this sample one that we
I'm
have
for
from
July
Charlton
1.
that it has selectmen signatures on the back page.
You know, that towns run differently on who's the procurement officer.
On our intermunicipal agreements, it is selectmen that sign, our selectmen.
And yours, right. I believe the chief procurement officer here in Dudley is
Okay.
the town administrator.
And just to let you know, as far as, any agreements, if you decide to, pursue it, it would have to go in between both towns for signatures, so there's
Right.
going to be a little bit of a
There'll be
lapse.
a time lag
Just
in
to-
there, I understand.
If you're aware of that, that's all.
Okay.
And that's only, by the way, that sample, that's a Charlton, is only a sample.
Right.
Until we receive the intermunicipal agreement from Sutton, nothing really could be signed anyhow.
Right. We have one, go ahead. You have a question?
I was just wondering if, before we moved forward, we had talked about, who was gonna house all the records, and we said that that's something that we really want. So do we have to have that in writing before we agree and sign anything?
No, as long as we find that there is I think that if you may want to incorporate reporting of any immunization, a copy of any immunization permission slip should be forwarded to the Dudley Board of Health as well. That's not included in the contract. The rest of it, virtually everything else is on Maven, which
Everything is
is
on
available
Maven,
to us.
right, as well as standard procedure. Anything I do for specific towns that I do for, they all get copies. That's
Right.
just part of business.
Right.
But if you want it in writing, you can just put it in writing.
So do you still think that as a board, we should agree to either go forward one way or the other towards speaking with Greg, or?
Well, I think before you can go any further, you'd need a proposal from the town of Sutton
Right.
in order to, so when your town administrator or your board of selectmen decide that they want to extend an invitation for services and create an intermunicipal agreement, just have them forward it to us, and then what we'll do is bring it over to the town administrator, do a quick review in comparison with both contracts, and you could, you don't have to make a decision tonight. Automatically, Harrington's will do a rollover anyhow, in their contract, there's an
It's gonna
automatic
roll
rollover.
over.
So we're covered till whenever we decide to terminate the services, that's all. If we did decide to terminate services. Okay?
Okay.
Very good.
And it's not a problem if we decided to terminate services with that other contract?
Yeah, I don't think there's a real problem. I'm not sure whether there's a notification period, but there may, we may have like a 30-day, or 20-day, or 14-day termination.
Right.
I think that's in the last page, typically on the last page of the contracts. I'm not sure what Harrington's contract says, but
We don't have that.
if it rolls over, it automatically rolls over.
Right.
This is 30.
So you'd follow, it's 30 days?
Mhm, page 4. The
That's
Charlton Sutton
the
one.
Charlton.
No, that's
That's a
not, no.
child.
Oh, I'm sorry, I don't.
Yeah,
This
go to the
one.
Harrington one.
You have it.
Terms, the term of this agreement shall be a period commencing on and ending on 30 days prior written notice,
30 days, okay.
sent via registered or certified mail.
So-
Okay.
If that's what you decide to do, then you'd have to give them 30 days' notice to terminate the services and then activate
Another
any new
contract.
contract with the next community.
Okay.
So have a discussion with Greg, get a contract from Sutton for a proposal,
Proposal?
Right.
Yes. So it's,
and then make a decision.
right. So yes, once your town administrator comes back, if you could get the proposal and,
I'll have him contact somebody. He can make a phone call and then follow through.
excellent.
Yeah, I mean, I think that they're interested in paralleling the contract that you've already established with Charlton, so.
That, I will say that's the standard contract that we have with all our communities. That's the standard contract we have with all
Yeah.
our communities.
I don't know that there'll be any difference, but again, that's,
Looks great.
All right, thank you.
Thank you very much for coming.
Okay.
thank you, Cheryl.
I just have one quick question. I just wanted to double check your town council, only because if it's the same town council, there's a little bit of a different snafu.
Our town council is Gary Brackett.
Okay. Thank you. That's fine.
Thank you.
Thank you for your time.
Okay, up next, number 8 is Nicholas Mitchell and Mitchell Associates, in order to appear. Hi, if I could just have you identify yourself, please.
My name is Nick Mitchell. I'm the president of Mitchell Associates Construction.
Okay. Tom, I'll turn it over to you.
Okay, Mr. Mitchell has a license to install septic systems in the town of Dudley, and there's currently a septic system under construction at, what number was it, 368 Dudley Oxford Road?
Yes.
368 Dudley Oxford Road. Unfortunately, I guess the system construction started in 2016 and progressed through, and back, I guess, a couple of weeks ago.
Correct.
The owner or the owner of the property requested a certificate of compliance. Well, it appears as though the Board of Health may have done one or no inspections out there at, again, no fault of ours. We weren't given an opportunity to, and when we asked the engineer if they received any requests, the engineer did not, according to Peter at Burton Engineering. And I did speak to Mr. Mitchell on it once, and he admitted that Burton Engineering was never notified to do any of the component inspections or any of the inspections that were required. Now, my concern is that Mr. Mitchell is says he has licenses throughout the county, and he does a lot of work in other communities that I do work in, or I've seen work in. He certainly knows the rules if he's licensed in all of those communities, or knows what the rules are. And obviously didn't follow the rules, or there was a breakdown somewhere along the line. And at this point, Mr. Mitchell was ordered, because no inspections were done, we ripped the system up. We had him rip the system up and start again. We took out all the components and all the imported material, everything that was put into the system, replaced it all with before we sign the certificate of compliance, it'll be all certified material. He states that he'll be able to provide us with copies of the sand certificates and the stone certificates, and for both quantity and quality, to make sure that they meet Title V. We were notified at this time to do the inspections as we went along. I've been in touch with Burton Engineering. They were supposed to go out and do a component inspection this afternoon. I don't know, or today, and I don't know whether they did it or not. They said they were going out, but were we getting any notifications from Mr. Mitchell, or from Mitchell Associates, for doing inspections or anything at that site?
At this current time, no.
We got our information from Burton Engineering, am I correct? Okay. And that's where we stand. I have, again, as far as concerns on this particular septic system, I personally have done inspections out there, and I find that as far as the quality of material and the quality of excavating and all of that is fine. I'm not sure what the elevations are and all of that. That's up to the designing engineer to provide all of that data on his as-built drawings and all of that. So we're not, until we get certification from the engineer, we won't sign off on a certificate of compliance. My concern, though, is with Mr. Mitchell that I just don't understand how it went so wrong with notifying all the parties. The engineer, the installer is obligated to notify both the designer and the local inspector.
Correct.
We have a 24-hour answering service. All you have to do is leave a message on the answering machine, and we will get there. In the meantime, again, we questioned it the first time around. We still, on the second time around, we didn't get any calls from you or your office. We got them from Burton Engineering. If that's how your business works, that's fine, but that's not what the plans say, and that's not what the law says.
We decided to let Burton Engineering take over calling the town so that we would not have a miscommunication a second time.
Okay.
This septic system has cost me out of pocket plenty of money because of some miscommunications between myself, the builder, and the homeowner. It's taken a long time to get the septic together because of monies that were not paid. So we weren't doing the work until we were paid. And along the way, there were miscommunications between myself, the builder. I guess the engineering firm is a friend of the builder. He decided he wanted to handle the engineering people. We let him know that he had to get the engineering people involved, and he didn't, because he had too many other jobs going on. Who knows what happened. As you can tell, this has been going on for almost a year now, and we're finally coming to a head where it's getting done properly because they paid, number one, and now I'm involved completely in it. But I would prefer that the engineering firm call the town the second round, because he'll definitely know who the right people are. I haven't worked in Dudley before. This is a first for me. I have built over 100 systems throughout Massachusetts in the last 10 years, and I've never had this kind of problem happen. So it's a total miscommunication between parties. There was nothing done wrong. The system was built correct the first time, and it's built correct the second time at my cost. And my good name is very important to me, and that's why I'm here in front of the board to try to not beg for mercy, but maybe get some understanding as to how it all happened.
Okay, I'm going to stop you right there for a moment. I just have a couple questions.
Sure.
You said you've been doing this for 10 years?
20 years.
20 years you've been doing this?
Yes, ma'am.
Okay. In the other towns that you work in, do you call the boards of health for inspections?
Yes, I do.
Okay. So you knew enough to call?
Yes.
Okay.
I did call this town.
For an inspection?
Yes.
And
For bottom inspection, there's a bottom inspection, then there's a component inspection, and then there's a final inspection.
I am aware of what inspections.
The three,
And when
yes.
you called, did you speak with someone?
I spoke with a girl in the office, don't know who she was.
Okay.
I don't know the people in this town, I apologize.
And did you get a call from the health agent as to that he went out there, that it was fine, that it was good to go?
I was told that we'll send the health agent, the inspector out, and if you do not hear from him, then everything will be okay to do your next.
Okay. That, I work across the hall from the clerk.
Yeah.
I hear her all the time. Normally, Tom follows up, letting people know. Tom gets in touch when you go out for a bottom. There's open communication all along the lines in Dudley. So I don't know how that happened, what happened on that. What about the rest of the inspections?
Well, I was told just the other day that the lady in the health department told me that she had conversation with me about the bottom, which I never had conversation, I don't know who she talked to, but I never had conversation with her. I took no response from anybody as the bottom was okay, and that's why we built the system.
So you assumed?
Yes, I didn't only assume, I called a second time 3 days later and was told again, if we did not hear from the inspector, then everything should be okay. And that's why we went forward and built the system. It would be ludicrous of me to do a system without inspections. It would be costly. You cannot get it to pass without inspections.
What about the component inspection?
I had called for a component inspection.
So you're telling the board that you've called in every time?
Yes.
And for some reason, just your particular system never got inspected?
I thought it was inspected because I never heard back from the, I was told if you don't hear from the inspector, that means everything's okay.
But now previously, and maybe I misunderstood it, and you said that the builder said that he was gonna let the engineering company handle things.
No, he was
That
gonna,
he was gonna be the one in touch with the engineering company, so you never called Burton to come out and inspect anything either?
not on the first one. He was supposed to handle that part of, Burton was a friend of his, and he was handling that with him. I believe there was a delay because of payment to Burton, so that might have been the
Do you normally
problem.
not contact an engineering company when you are the installer?
Not much, no, because I usually know who they are.
Right.
This person I never met before.
Okay, but at least the years that I've been involved in doing things, normally the installer and the engineering company kind of work together, and
Sure.
they know what one hand is doing and
You're
the other hand's doing.
absolutely right, I make no excuse for that.
Okay.
I'm wrong there.
That, I just want to make sure that we understand that.
Yes. It won't happen again, that's for sure.
When did this system start, when did you start installing it?
Last year at this time,
How many people are on your crew? I drive by there multiple times a day, and I've noticed that property sitting there.
I have 6 people on my crew.
6.
We left one person there along with the builder's cousin who has wanted to do some work to make the costs lower. So we allowed him to work with one of our guys.
So the person that was running the backhoe was one of your guys or a
One of
friend
his
the
people.
builder? Working the backhoe to install
One
the
of whose
septic
people?
system?
Yeah, his name is Mark. He's a septic installer in many towns also.
I'm sorry, was he your guy?
No.
No, I have had
Was
my own,
Mr. Wee's guy?
yes. And I have my own guy working with him.
Okay, so I have one more question. In
Yes.
any other towns, have you ever allowed someone else besides your own crew?
No.
Okay, thank you.
My question now is, Mr. Mitchell, did you allow somebody to work under your license?
No.
Without
I had
any
my own-
supervision from
I had
you?
my own people there.
Well, you just got done telling me, saying to the board that you had somebody else running a backhoe there. Was it unsupervised?
He was a helper of, basically, he's working for me. So he was working with my man. My man was laying the components. And this guy was a helper. You can't do it by yourself.
But he was not an employee of yours. He was one
No,
of Mr.
he was not an employee of Mr. Wee, but
This is the
a
classic
friend.
problem that we've had with this site. Is
site
that it's
seems-
always friends of his that are doing stuff.
There's always, it seems like, yeah, I've seen
And they're using-
couples of
they're
young
using a major
kids, young
contractor's
people
license.
going in and out, doing things on that property. Has it gone through the building department? Are the permits in place? Are there any inspections of the building department?
There's,
I have here, one of the things, it's a letter from Burton Engineering that says, this letter is to notify you that Burton Engineering has prepared an as-built plan for the septic installation at 368 Dudley Oxford Road. Please note that Burton Engineering was not notified of the installation until the finished grade was complete, and that we did not perform a bed bottom or a component inspections. The components were inspected when, the components that were inspected were consistent with the design plan. What they did was, they had them dig up a distribution box, a septic tank, and I saw the excavations as well. There was only one pipe. I don't know how you can inspect an entire system by looking at the end of one pipe and knowing where the distribution box is. But again, also, it's not my jurisdiction to
Right.
go out there and start shooting the elevations and all of that. Burton is not, also was not provided any information on the fill material. I have attached a certificate of compliance that, and have added a notation that only these components were able to be inspected and the compliance, and were in compliance with Title V and the approved plan. So there were 3 components that Burton Engineering did shoot and witness. They did not receive any notification of any inspections, and that's why Mr. Mitchell had to rip the system up. For whatever reason, Mr. Mitchell and Mr. Wee worked out an agreement between them to let this progress and digress the way that it did. Mr. Mitchell's license is on the line.
And my money in pocket have come out of my
Well-
pocket plenty to fix it on my own now.
Okay,
I have
so-
taken over completely and not let them tell me what's gonna happen. I'm the one that's telling them how it's gonna be now, because it's too far into this and too expensive at this point, so it needs to be repaired by me, and that's why I'm here doing it. As you were on site today and saw what we have accomplished in amount of 2 or 3 days.
Well, it's, believe it or not, that's a 1 or 2 day job, everywhere. It's a 1 or 2 day job. As long as the inspections are done. I live right down the street, so all I need is notification, an hour or two's notice, I can go up there.
I think the most delay was Hilka's trucking into the
I
site.
understand that, but my point is that we have a situation here that went uncontrolled, and this can't happen. We're not worried about Mr. Wee, we're not worried about Mr. Mitchell. We're worried about the guy that buys the house 5 years later or 10 years later when they come back in with, if they come back in with problems with their septic system, and the statute of limitations is up, and we didn't do our job.
Watching the way that the house is being built, I wonder, is the builder still the owner, or who owns the home?
We find out that that's not the case.
That's correct.
The builder and the owner are 2 different people.
So the house was sold half-built, from what it appears as I drive by it. That is my opinion of the situation. I drive by it, there was a for sale sign, then there wasn't a for sale sign, then random people are doing work there on a random basis. The septic system looked very random every time I drove by it being installed. The people in and out of the house, the dumpsters, the way the porch was built, the finish work, everything is just
trash all over the driveway that
half, you know.
We spent trying to get them to clean it up.
Numerous
There's
contacts.
something, I don't think, I have a feeling that the owner of the house already owns it and they did most of the work themselves. Did the builder pay you, or did the owner of the property pay you?
The builder,
Who, do you work, so you work for the builder, not for the homeowner?
correct, never met the homeowner, don't know
Don't know
who
the
it is.
homeowner, okay.
I know that he is a real estate investor, so he may have bought this so that he could resell it for a profit. I would imagine that would be the case.
I see.
Regardless, I am here to finish the septic, to get it signed off and get it done properly, so that I can move on from that project and distance myself from the entire situation. And I'm willing to do whatever it takes to satisfy the board.
At this point, where do we stand with the septic
Well, we're
system?
looking for sand certificates. We're looking for quality and quantity. We're looking for stone certificates, quality and quantity. And we're looking for certification from the designing engineer that all of the system components have been inspected and installed according to the plan.
Now,
And until we do that, what happens is the designing engineer will sign off an as-built and a certificate of compliance. He will then pass it on to the installer, who will certify that it's in compliance, and then pass it on to the Board of Health for us to review. But we're not gonna review it until such time as we see the sand certificates and the stone certificates, and the certification from the engineer that everything is where it's supposed to be.
And so when is this all gonna happen?
By Monday, they'll have everything that is necessary. we should have the completed system finished by then, and the inspector for the engineering company has already been on site today. So he'll have his report also in his as-built, so that has passed his muster. I believe it has passed Tom's muster. And we're ready to cover the system and get it hydro-seeded so that we can have a final inspection. And I'm hoping to have that done by Monday afternoon. And all the receipts from Hilka, the quality and quantity will be on those receipts for the board.
They typically, what they'll do is they'll fax them directly over to us from Hilka.
Well, I'll request them to do that
Yeah,
then.
that's what you should do.
Okay.
Do you have a pen, and I'll give you their phone, I'll give you our
I do.
fax number. 508
508,
949
okay.
8031. And they will fax or email over all of the certificates. And
I'll call them first thing in the morning and see if we can get that done right away.
that's a standard, by the way, virtually everywhere you go.
Usually they give us slips and we hold on to them for the
Well,
inspector.
I understand that, but
Inspections, do we
some
cover that?
pits
The building,
don't just hand out slips.
I haven't taken
It's
care
it's a
of that.
tough thing to do.
Yep.
What they would rather do, especially if they're delivering it, that means they know that the product is coming here and the exact quantity that's being delivered here.
If we've gotten-
I'll get them to fax that
Very
in the morning.
we know who's
That way it'll go direct.
been done correctly.
Yes, the inspectors will all sign off.
Okay, okay.
Tom, we've worked with Burton Engineering before
Yes.
as a town. Have we ever had any hiccups with them?
Nope.
Okay.
What is our, what do we,
Well,
It appears as though Mr. Mitchell is the one that ultimately becomes responsible for his company and making sure that communication, you can pass the responsibility off to the builder, to the lady on the street corner, or anybody else. Ultimately, it's your
Comes right back
license.
to me.
It's all yours.
Yep, and it's cost me dearly, so believe me, this won't happen again.
If, whatever action the board chooses to take, suspension, revocation, stern warning, stricter oversight, whatever you choose to do.
okay, a couple more questions for you. Now, I've been on this is my 9th year, and I don't recall ever having any problems similar to this. Issues with messages getting to you, inspections, or anything of that nature.
Nope.
I just was making sure okay.
We've got a pretty good system between technology today, telephone, fax machine.
what's
And-
that? We don't barely use that.
Oh,
thing
we even
anymore.
have, Ted, we still have the old-fashioned way of,
Yeah,
even
what's that?
even a phone with a tail on
I
it.
have a phone line in my house
I got a
anymore.
phone line with a tail on
Well,
it.
it's there, it's just not used. Right.
But we make sure that we're available. We have virtually every method of communicating that we need, so.
Mostly the problem on this system is it took too long. Payment was not made like it was supposed to be made because there was change of ownership. And we stopped working until, we were paid to go forward. And I think maybe the time period in between, things got lost in the shuffle. So I apologize for that, but ultimately, like I said, it's my fault. I take
can honestly
responsibility.
see how that could happen with the time that house has been there, and then they quit that house and went down to their ones further down in Oxford where they're front and back, and they started working on those instead, and then they gave up on this one, and then this one just has been sitting there.
Everything was been that way. The siding was the same way.
Yes.
Everything was the
Yeah,
same
it
way.
was-
I guess one of the things that, I don't know, and it concerns me, bothers me, I don't know, that you let someone work on a system. I know one of your guys was there, but then you let someone that you don't know anything about.
Oh, I do know him. He's a very good worker. He does a good job. He's got licensed, he's hydraulically licensed to run a machine. He's been doing it his entire life for over 30 years. And if he was not such good friends with the other guy, I'd hire him myself, but he doesn't want to leave the other person. So The only reason he worked on this site was for him to try to save money in the long run. They were trying to save money to do the system more cheaply than it normally should have been.
And again, it was a weekend job.
Yes.
Whoever was doing it was weekend work, and it was winter, and I'm like, what are they, it seemed to be, was it winter? It seemed like
It was
winter.
approaching,
It
it was approaching.
The original bottom inspection was called for, which we looked at, was around October 5th.
Correct.
But, now the system was left open all winter, and now they go in and they start to install the system. Well, there's a practice that has to be addressed when you do that. The whole bottom has to be re-scarified, it has to be scratched up and excavated again, and then you're supposed to call for another bottom inspection at that point, before fill gets put in. You can't just leave a system open all winter, because what it does is it starts to silt up and sort out, and the system gets a 10-year life expectancy instead of 25. Again, communication, ultimately, no matter how you cut it up,
I'm still responsible.
you're responsible.
Sir.
It's your license, and,
To do.
you know, whether it's, you sold your license, or you let somebody work under your license, and there was a breakdown, that means that the
Have an idea in your head?
homeowner was working under your license as well, because he was supposed to represent and communicate for you, which he didn't do.
No.
In Dudley? Just
I
here?
don't know. Yeah, I mean, I don't know.
Oh.
So, my one comment to you is, and I think as board members, we all feel this way, we take a lot of pride in making sure that Tom does what he's supposed to do, so that good systems go in, so that when people purchase homes and things happen, they're not having issues with their system. So Dudley, we want to make sure that, you know, Dudley is known for taking a lot of pride, and we don't like when things like this happen.
I would hate to be
I
the
understand
realtor
that.
that
Yes,
sells
ma'am.
that house
Right.
after the fact. If, knowing what I know right now, if I go show a buyer that house because I'm a realtor, what am I supposed to tell them? Right now, I have to tell them that this system had to be ripped up because it was installed without the proper inspections. And now I'm assuming that, now that it's done with the right inspections, I'd have to say, take it at your own risk. And it just isn't.
Well, we
it
know that
isn't
it's
a-
done correctly now.
Well, we know now it is, but we don't know the rest of the house is now in question.
Yeah, it's just that uneasy feeling. So I guess what we have to discuss is what we want to,
How many systems have you put in Dudley?
This is the first one,
This
sir.
is his first.
Oh, all right, that's what I thought you said.
And I don't usually let anybody work with us. We usually do it on our own, but in this case, I allowed it, which was foolish on my part. It won't happen again, that is for sure. I don't want to have to go through this expense, nor this embarrassment in front of the board. I've had enough, and that's why I took over immediately, and it's gotten done the right way, as it should. All I can do is ask for forgiveness of the board. I have no excuses.
So before a system goes in, there has to be a permit request, and
right, and basically, they have to, before they can install in Dudley, they have to take out an installer's license with us. So like, nobody can just come in and say, I'm gonna work on this.
we get the plan, the
The plans
septic
before,
plan.
they come before everything else.
Yeah,
Before the house is even built, and before the foundation is built,
Yes.
the septic plan
Right.
comes in first,
with the perk and all that
with the
business,
perk and
yeah.
the well, and the well location, proposed well location.
Just because we're on camera, we're just talking out the basics, so
Right.
anybody watching understands what we're talking about here.
Right.
There's a full progression of what happens, and once, if there becomes a breakdown, then what happens is the whole system starts to deteriorate, and how the quality of work becomes jeopardized, and,
I can assure you that the quality of work on this particular home at this point is way over above board. There'll be never a problem there.
Well, again, I've already reviewed the septic system. The plan had been already approved, priorly approved last year. The system obviously had been ripped out and replaced according to the standards. And it's been done in the last week or so. Everything has been where it's supposed to be, as far as quality of material and excavating.
Can I ask one question, just curious? When the plan came in, did we have an installer then? Or did the-
Oftentimes, no.
Right,
What happens is we approve the plan pending selection of a licensed installer. So it sat until Mr. Mitchell provided us with information, and we gave him his license because he had a proven track record in other communities, especially our local sister communities around.
and that's
He's
some-
already demonstrated his competence and understanding of Title V, and he's worked in towns that I'm very familiar with. Not like the others that come in from other areas outside the area.
right, right,
The other recent one that we had,
right.
it was not done properly.
Let's move forward.
Okay,
What are you,
I don't,
what are you proposing?
I don't know. What,
Is it a fine? Is it a suspending from working in town? Is it,
a stern talking to,
is it a?
never
we've
work
got- we've
again?
got
I mean,
John.
we're going
I mean,
all over.
obviously, I don't think that you were trying to put in something inferior, but my biggest concern would be that you would have somebody, a guy that's working for someone else on site running a backhoe with you not there watching what he's doing, because they want to cut costs. So if they want to cut costs, who put the materials there? Did the guy who doesn't work for you bring the material in? Did somebody else, the builder who's trying to cut corners, bring it in if you are not on site? That's the only thing. I don't think that because you had somebody working there that wasn't working for you, anything could have happened.
Sure, understood. None of the material was ever inferior at any time, but you're correct in failing the way you do.
Roberta, you got anything? You want to chime in at all?
I'm thinking. It's tough.
Go ahead.
I'd suggest, this is his one and only opportunity. If he chooses to work in Dudley the next time, he becomes personally responsible. It's his company, not any representative or sub-representative that contracts the engineer. Again, you must notify the engineer, because we don't come out and hold each other's hand and do simultaneous inspections, but we do our inspections.
And I would say overkilling us is better than under,
Right.
Sure.
This is what happens with underkill and assuming.
yes.
Cost you a bunch.
Yes,
I
ma'am,
mean,
yes, sir.
there's a certain amount of cost that he's already been punished. I understand
Right.
that.
I get that. And
And-
let me ask you, has he been cooperative since
Never
being
questioned.
since being notified of this?
Never a
there's-
question.
Okay.
Well, it would be my
speaks
recommendation,
highly,
since he
thank
doesn't
you.
work that much in town anyway, to just say, we've got your number, and we, called you to the carpet for a reason, and with that, we'll be keeping an eye on you if you have another application here in town.
Thank you.
That would be my recommendation.
Yeah,
Do
so
you
you're making that
agree?
as a-
One
yeah.
I'm making that
time.
as a,
You're making that as a motion?
yes.
Do you want to second that, just so we
Yeah,
can?
second that.
Okay, I think that's very good. I think that, that you come in, you feel free to come work in Dudley again,
Thank
but
you.
you will be held,
Understood.
I
come
think
on,
there's something, there's some,
I'll be under scrutiny.
yeah, the slightest little thing, and
Gotcha.
you'll be pulled to work probably.
Fully understood, and I
That would
appreciate
be
that.
my, again, I think we're a pretty good town. We try to
definitely a good
Yeah,
town
we're not here to
work
kill business.
No,
No,
no.
it's definitely a good little town to be here, and I enjoyed working here.
Any other discussion about it before we take a vote on it?
No?
Okay. So I have a motion and a second. All in favor?
Aye.
Aye. Passes unanimously. So, thank you for coming tonight. We do appreciate that. Definitely, when you come back to work in town, just be overly, call us every day, really.
Understood.
I would rather have you
Communicate.
annoy her with communication,
Okay.
and that's okay, because I sit across the hall from her, so I'll see her, that's fine.
Okay.
But I would rather have that, and I'm sure Tom feels the same way.
Yep.
And be
Make
responsive.
sure that if you're gonna call, leave a contact number or a text message, we can text you back that it's all set. Wait for engineer, blah, 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 but, one way or another, we find a way to communicate to somebody,
Yes, sir.
all right?
And,
Worst case scenario, I used to leave business cards right on the machine to let people know I was there.
Nobody can talk to you, though. We can't get a hold of you.
Tom's easy.
I'm approachable.
And, it was a costly lesson
Yes,
for
ma'am,
you,
it was.
unfortunately. And I would just, in the future, maybe only have people that you know on the site to ease us a little too. It's your license on the line.
Great suggestion. Thank you.
Thank you for coming. Okay, up next, Tom, you're up. Health Inspector's Report.
We took care of the issue at 141 Southbridge Road. There was a question of improper repair being done on a septic system. We confronted the individual. We found that there was some wrongdoing there, but he's
41
mended his
Southbridge
ways.
Road.
Gentleman was working on a septic system and come to find out it was in disrepair. What we did was we ordered him to have a Title V inspection done, check the components. We found out the pump chamber was,
That was the two-family, wasn't it?
yes.
Yes.
We had him do a Title V inspection. We found some problems and several different types of problems, but all the problems have been rectified and the system has been addressed and brought into, some improvements have been made on access and the homeowner now has a better understanding of what the septic system really is and how to maintain it and how to address any problems. He's not to take care of the problems himself. He's to hire professionals to do pumping, do repairs, do whatever needs to be done. We have a couple of other issues with rubbish right now. We have one that's they're battling in the courts about it, and we're using the ticket system as an incentive, but it doesn't seem to be working. To the tune of $300 a pop, and I'm just about to deliver my second ticket, even though I should be going there weekly. We gave them a little bit of the benefit of the doubt, but nobody seems to be willing to budge, so we're going to pursue with stricter enforcement. Other than that, it's normal everyday business. There's some building activity going on, and all of the housing issues have been addressed, so.
Excellent. Okay. Any old business? Can I just bring up, I do know that Yummy's had their kitchen remodel,
Oh, yeah,
and they're back open.
yes, they are.
And I haven't had a chance to stop by, but I am going to off hours, just to look at the kitchen remodel.
I want
Not-
to see it and go and
nothing-
congratulate them on it.
Yes,
That's what I'd like to do.
I really think that,
David is really happy.
Yeah, so I'm impressed, Chopper. I'm so excited.
yeah, that's the
He was kind of resistant at first, but now that it's done and it's over with and the smoke is cleared, he's really happy that he did it, and he should be proud of himself because the place looks beautiful.
Excellent. I'm very happy. I know it took a little longer than they'd hoped for. They ran into a couple of
Oh,
things.
this was never gonna happen in a week.
No.
No, but they got some staffing improvements, they got,
Yes.
that they needed, desperately needed. They discovered staffing problems. They rectified all of that. Probably one of the suggestions that I would make is, even though we've sent them a letter that they could be open, but you might want to have their consultant company do one more follow-up, say 30 days after the grand opening, so
Yes.
maybe like by the end of July, one more, do a follow-up inspection there for any critical violations.
Yes, that would be one, just to see how they're doing in their new.
They discovered
improved-
other problems that they had that they didn't realize they had either.
Yeah,
Structural problems,
yes.
and everything in electrical has all been addressed, so.
And I'm so happy for them, and that's exactly what we wanted, is for them to have a better work environment, and I'm sure, I hope, hope he's very happy, and
Now it's given an opportunity to prove themselves.
that's right. So, very happy about that. Any other old business? Are we keeping you up? I'm sorry.
Excuse me, sorry.
Any new business? I don't have anything. I just will state that our next meeting is on Tuesday, July 18th. Does that work for everybody? Just check your social calendars, make sure there's nothing going on. Good.
I think we're good, because we put it in a while ago.
Right, I'm just double
Yeah.
checking. Excellent.
Okay.
I'm good,
are you
I'm
good?
good.
All right.
Yeah, I'm good. So, all right. Ted, you good, or? You gonna be vacationing somewhere?
No, I
or-
have just a church meeting on the windows, but that'll be fine. We'll be good.
Okay,
It'll be good.
'cause,
Yep,
excellent.
very
All
good.
right. I'll entertain a motion.
Motion to end?
Yes.
Okay, I make a motion to end. that what we
I
say?
second the motion to end.
End.
Or adjourn.
Adjourn, end.
I have a motion to adjourn in a second. Any more discussion? Seeing none, all in favor? Aye.
Aye, you're so fun.
Meeting ended at 7:42. Thank you very much.